Welcome to the Global Neurosurgery Conversations. And this is episode 4, 1,000 kilometers per surgeon. And my guest today needs very little introduction. Professor James Rutka is a pediatric neurosurgeon at the University of Toronto and Sick Kids, a former president of the WFNS, the AANS, and the CNS. We are beyond happy to have you with us today, sir.
Yeah, thank you very much for the introduction.
Thank you, sir. Today's episode is going to be interesting. There are some relatively difficult questions that might make you feel as if you're in the spotlight. It's okay if you want to skip any or you don't want to go ahead with it. So the 1,000 kilometers is not a distance. It is the accumulated weight of every choice that pulls somebody away from their comfort, from proximity to the family, from the ordinary rhythms of life. It is the cost of becoming, essentially, the cost of doing what is necessary, even when the body is tired. So my first question to you would be, when did neurosurgery stop being a career choice for you and start becoming the part of your identity? What did that transition feel like for you? And was it exciting or was it also frightening?
Yeah, thank you very much for the question. I'm happy to try to answer all the questions you pose for me. I've been very lucky in my career, so I can reflect back on the types of issues you raise with your question. And I can tell you that I was interested in neurosurgery a little bit late in my development as a professional. So obviously I went to medical school, and following medical school, I was interested in the surgical disciplines. At first, I wasn't sure it was going to be neurosurgery. I was contemplating orthopedic surgery, general surgery, a few others. But then I did a rotation as a medical student elective at the Hospital for Sick Children, where I work now as a pediatric neurosurgeon. And that just turned the lights on for me. I saw instantaneously that that was exactly what I was destined to become. It felt to me like home. Like if I could be a neurosurgeon, I would be the happiest person in the world. So it was that kind of attraction, that exposure at first to neurosurgery, seeing what the life was like of very talented neurosurgeons at this hospital where I work back in those days. And remember that we're talking almost 45 years ago or more. Subsequently deciding to go into the residency program at the University of Toronto, to which I had applied, and starting really my career path from there. But you're absolutely right with your question. A journey of 1,000 kilometers begins with but a single step. And my first step was, of course, entering the residency program at the University of Toronto, having successfully gone through medical school. And while I was a resident in neurosurgery at the University of Toronto, and even before that, I just really felt like I wanted to be the best doctor possible for the patients I looked after, which meant, to be honest, a lot of time on task, learning in the background, being in the hospital environment quite consistently over countless hours, days, weeks, and months, and learning the skill and the craft of being a good doctor at first, and then through residency, learning how to be the best neurosurgeon I could become as a resident, and then looking after that at career choices on faculty once I had finished the residency, and that led to a number of other branch points in my life, which I think we can talk about in other questions you may have.
Thank you. So you have had a full professional run, a very interesting professional run. Early in our career, a lot of young consultants, like I am just starting my consultation period now, we are often told to sacrifice now and balance later. Looking back, what sacrifices were worth it for you, and which ones do you think young surgeons should be more careful about making?
I mean, it's not just specific to the field of medicine. You can look across all professions to a degree and say that to become the best professional that you want to be, it takes time on task. And what does that mean realistically. It means that the time you spend on that task to become the best professional will mean essentially time taken away from other aspects of your life, which include very important things, which we'll get to, I'm sure, in questioning, like family, like your hobbies, like your activities, like travel, like so many other aspects of one's full and entire life. So, but if you're motivated and if you're goal directed, as I was as an early neurosurgeon, and if you have support of those around you, and I'll speak about that in a moment, then the sacrifices which you allude to become less significant, and but still you need to be mindful for some of the things in your environment, of course, so that again you can fulfill your goal of being the best professional, in my case, best neurosurgeon I could be. Now, what kind of a support am I talking about? First and foremost, I would say to everybody on the line that one of the most important things in your life is to find happiness insofar as partnership is concerned. And I have been truly blessed and fortunate to have a very amazing, wonderful, supportive spouse, a wife. Her name is Mari, and we've been married 46 years. It'll be 47 years. And all along this journey as a neurosurgeon, she's been incredibly supportive of everything in my career path. And also similarly, it's as with a lot of things in relationships, it's a two-way venue or street, and you must also give in return what you have received. So we've made a great team over the years. We have three wonderful children as family members, and they're all grown up now, but I distinctly remember them as children, and I spent as much time as I could trying to be with them in their formative stages of growing up and also in their development, recognizing some of the limitations if you're time on task as a neurosurgeon, but somehow I managed to keep all the balls in the air most of the time without too many falling down and feeling regret or remorse over the fact that you might not have balanced everything perfectly, or you might have missed out on some things. But there's no question to devote the time as a neurosurgeon means that you have to take time away from some of your other pursuits, other activities, but in balance. And if you are good at things like time management, as I always seem to have been, there seem to be enough hours in the day, 24 hours, a long time every day, to be successful at accomplishing most of your goals each and every day throughout your life.
Yeah, that was a very insightful perspective. And yes, I guess time management and then multitasking, that goes hand in hand for us. We cannot sustain a lot of other things otherwise in life. So you're absolutely on point. But I'm also interested. I'm very glad to know about the kind of familial support you have had. But you would, I'm sure, agree that neurosurgery creates a particular kind of loneliness that is almost impossible to explain to people outside it. The loneliness of being surrounded by a family, friends, sometimes even colleagues, and is still feeling at certain moments profoundly isolated. So, have you experienced that, and how did you deal with it?
Yeah, I hope I understand the question completely, but the loneliness factor comes from, in essence, the care we provide for the patients in neurosurgery that we treat, and the fact that if you're doing enough true neurosurgery, meaning types of procedures as I do, taking calls as a neurosurgeon and dealing with patients who may have, let's say, complications or outcomes that are less than satisfactory, or challenges, day to day, trying to manage your schedule to look after the patients that are on your service, not knowing how that's all going to work out, and feeling the pressures that are involved in those types of situations. Yeah, you need help with respect to the balance, keeping yourself balanced in life, and also trying to shed that loneliness factor that you mentioned. And for me, the solution were a few fold, but the first and foremost, as mentioned, was my reliance on, dependence on, and comfort in my family, and the fact that my wife, who was truly there for me all the time, when I explained situations to her, for example, when I was in the hospital with a complicated issue or management issue, and talked it out with her and sought some advice. Typically, it's great to be able to share such turmoil that we may deal with in the course of any day, and then have a potential solution or just seeing it from a different light. That to me helped to shed the loneliness factor that you have brought up. And the other thing is, I'll mention to all those on the line that may be listening is to keep yourself balanced is critically important in neurosurgery because the prospects of everything we do and also the challenges that we face every day are very significant. And in order to deal with them at the highest level, I mean, you need to be in the best frame of mind. And so that encourages all of us to seek either comfort or a routine where we are able to have that balanced mind. And what I'm referring to are things in your life that help to restore items like balance. So I'm speaking about your hobbies, your activities, your fitness, your health, looking after yourself, and making sure you come back to work if you're down and lonely, let's say, coming back to work fully energized, charged, clear mind, and ready to go the next day. So that should become a routine, I would say, for neurosurgeons. And it's been my experience that those that don't have that type of balance in their lives or routines that help them stay fully committed to their patients, but also balanced in the sense of having a clear mind to make the most objective and best decisions for patients. That's where the issue of burnout, stress, and major conflicts arise in the workplace for neurosurgeons. And I've seen it time and again across all the associations I've had with numerous neurosurgeons, and I've certainly witnessed it in my own faculty. I've seen it across other faculties across, North America. So it's very, very common. We wrote a piece about this actually in the Journal of Neurosurgery. It was in a section of the journal called Broca's Area, where we just talked about the balance that one requires to stay the most effective neurosurgeon. Article that I wrote with Bob Harbaugh and with Bill Caldwell. You can check that reference, but some very good advice there on how to stay out of difficulty, how to avoid loneliness, how to keep yourself at the top level, balanced, healthy, clear mind, and able to complete your tasks as a neurosurgeon every day.
I am actually surprised about how you're not glorifying the hustle culture and, isolating oneself or completely ignoring the other aspects of life. Because, yes, at the end of the day, the family and friends, they do become the base camp to which we come back to after we have been done with the hike of the day. So I am very surprised, and I'm happy that somebody who has achieved it all, at least in the way we define all, it might be different for you, and it's coming from their side. So there is hope for us at the end of it. So, Professor Rutka, I'm also aware of your profound work in Ukraine that you have been doing and how your projects have continued despite whatever goes on geopolitically. There is a difference between a career built around what you can achieve and a career built around what you can give. So, was there a particular point where your definition of success changed from personal accomplishment to service?
That's a good question. I never looked for positions to drive success forward for myself. I mean, I just did my job as a neurosurgeon. I also have a very active academic life and side to my profession. So I've had a research laboratory for now more than 35 years. Very, basic science laboratory that requires a huge amount of investment in time, energy, and effort. As part of that, however, I was, publishing in the literature on my main area of interest, which is and continues to be neuro-oncology. So that made my name, I suppose, known throughout neuro-oncology circles in the world in neurosurgical oncology. I then, I started to get involved in organizations. Probably the first that I spent a lot of time with was the American Association of Neurological Surgeons. And my advice to, I think, junior neurosurgeons on the line today is really if you're involved in these organizations and you want to make them better for the future of our specialty, neurosurgery, you can't start at the top. And it's not all about your personal success and climbing that ladder. It's really about participating in the process and doing whatever job is given to you to complete and just being satisfied with that, which I was. But I was also very fortunate that having done the work in these organizations and committees along the way, that I was being recognized as somebody who was able to complete a task, and not only that, but could do a task well, and was given more tasks to do. And the more you do better and well, the more it seems comes your way. So yeah, I did all of that sort of work, not to put, not to get up to the top of the ladder or to have, as you had mentioned, accolades or awards or honors, but rather because I wanted to make these organizations better in what they do, what their missions were for our specialty of neurosurgery. It just so happened, however, as you mentioned at the beginning, that I was very fortunate to serve in the ultimate leadership positions of these organizations. But having done that, that's also service work. So your, second part of your question is, when do you turn to service work? And you mentioned Ukraine. It turns out that I'm going to Ukraine tomorrow, and I'll be there for many days. I've been doing this for more than a decade. Um, the way in which I got involved in Ukraine is in part because of my heritage. My heritage is Ukrainian, but in fact, I'm in North America. And while my parents kept some Ukrainian culture alive in Toronto, where I grew up, we really were not at that time as a child tremendously focused on the Ukrainian community or growing up as Ukrainian Canadian. But just later in life, more than a dozen years ago, an opportunity arose for me to go to Ukraine and to help because when the Soviets withdrew, when Russia kind of formed its own country, when the USSR was disabled and Ukraine became independent, the Soviets pulled out all of their supports, infrastructure, equipment, and so Ukraine was functioning and still is to a degree as a low middle income country. And there was a tremendous need and also opportunity to help them do better for their neurosurgical care of patients. I could see that instantly. And so when I first went to Ukraine about a dozen years ago, it was like operating in the 1970s or 1980s. It was very far behind. None of the equipment that we're familiar with today in most North American centers for neurosurgery, none of that equipment was available back then. But there's some really good neurosurgeons there who, despite not having all the tools and all the equipment that we have, can still do very fine neurosurgery, but they're limited by virtue of not having, for example, things like navigation, state-of-the-art, microscopy, even, bipolar and suction was limited when I first went to Ukraine. So it's improved enormously, in part because at the centers we've been to, and we've been all over the country, because we've taken it upon ourselves to help with an education system, to train them, to do lectures, to give consultations of patients there, but also to bring equipment. So we've put microscopes, intraoperative ultrasounds, variety of other like endoscopes, things like that in a number of centers where instantaneously they can go from doing 1970s, 80s type of neurosurgery up to the current time and have improved in the patients they can look after. When we first started going, in some centers, they weren't able to do complex tumors, for example, in these centers. So the children had to either go out of country or go to very select centers in Ukraine. So in any event, it's come a long way. It's been a fantastic and very gratifying part of my career. Sadly, COVID happened, and during the COVID era, I was unable to go. Nobody could travel during COVID. And then, of course, the full-scale invasion occurred 4 years ago, and that initially stopped us for a year or so from going. But now, at least for the last couple of years, we've been going to Ukraine. As mentioned, I'll be going back tomorrow and looking forward to seeing all my colleagues. We've developed these lifelong friendships and really look forward to seeing them as they look forward to seeing us. And I'll be there. And interestingly, I'm hoping to meet up with my good friend, Dr. Henry Marsh. And some of you may know Dr. Henry Marsh, who's written his book on complications, do no harm. He's had a significant role to play in Ukraine for decades now, and he still travels and brings lots of equipment to Ukraine and helps with their education systems and their surgery and so on. And as mentioned, I've got a team of individuals who will be traveling to Ukraine on this occasion and looking forward to our involvement with our Ukrainian colleagues there and hoping we can help them continue to evolve into the best neurosurgeons they can be and to look after the patients there as a form of service, which was what your question asked in the first place.
I think you might not see it that way, but probably the best way to leave anyone's legacy is, being in an OR in which you probably will not step again because you trained a particular person or a particular surgeon and they end up treating a lot of patients. So it's like your hands being there in the very spiritual sense, but not being there. And the physical presence is not needed. So I think that's the best kind of legacy anybody can leave when the work continues on. And I understand that it might not come from the same point. Um, but that is probably the ultimate outcome. Apart from
I
that,
agree.
yeah, yeah, yeah.
Oh, no,
So,
sorry. I just say, yeah, I agree with you. Education is critical. And you teach somebody to do something, and it's an amplification effect, just like you mentioned, that they can then look after patients without your being there. I would also say, one benefit of COVID was getting online like this and being able to teach and do case conferences with our Ukrainian colleagues, giving lectures to them like this, and also being with them. And soon, telesurgery will be available. It already is to a degree, and helping colleagues without having to be on site is fast becoming the norm. And you know how AI is evolving and robotics, and it's going to be tremendously influential on the future of our specialty.
exactly. I think COVID ended up opening a lot of doors that were previously not available. Like, I cannot imagine a senior colleague of mine 4 or 5 years ago having a conversation like this with a person like you in my position. So it is an immense blessing, and I'm very, very happy with that, with every episode that I do. And I think the best way we can start to give back is to teach whatever we know, learn and then teach it ahead so that the cycle continues. So the residents that are currently watching this conversation or would be watching, some of them are exhausted, some of them are quietly wondering whether the life they are living is actually the life they want. Some of them are still ambitious. What do you think the young neurosurgeons misunderstand most about long-term success in neurosurgery?
Yeah, I think the work today is probably very similar to the work that we did when I first started. So now, then the 40 years that I've been involved in neurosurgery, I don't think that has like the actual work itself. desperately ill patients being looked after by professionals who are neurosurgeons. We talked at the beginning about complications that arise. I think on the whole in neurosurgery, perhaps the day-to-day workload that's imposed on neurosurgery trainees in regions of the world, maybe perhaps where you are in Pakistan or elsewhere, where there aren't so many assists like there are, let's say, in North America to help the residents throughout the day. Um, we have a cadre of other professionals who help do things that take some of the burden or load of caring for sick patients off their task list. So we have various nurses, nurse practitioners, physician assists that are helping with the day-to-day workload that's at times can be very onerous, very tedious for the residents in neurosurgery. But I think in some regions, like maybe some of the low middle income countries around the world, that's still left to the neurosurgery residents. And they may wonder, like, what's all of this all about, this onerous nature of doing things, transporting patients in the hospital, writing all these notes that nobody may read or care about, um, doing all these like minor procedural things that could be done easily by a healthcare professional that's not a neurosurgeon, and so on. Like all those things now are, at least in North America, are are largely removed from the plate of the neurosurgery trainee, and so I think that's good. But I would say to those, let's say, who are still occupied with and struggling with the workload of what it's like and feeling lonely, to get back to that word again, just keep asking yourself, is this something that you feel motivated about at the end of the day? If you can see through all of that and recognizing that soon you're going to be an independent practitioner of neurosurgery and that you really enjoy looking after your patients for their diseases that they have, you enjoy the prospect of them getting better at a time in their life, intervening at a time in their life when they're critically ill and making them better. I think keep your eyes on that light in the tunnel that's ahead of you, because you'll get there and it'll all be worth your effort.
Um, Interesting that you mentioned the light at the end of the tunnel. Um, I think it's a lot harder for the residents who come from LMICs or from the middle income countries, because obviously the system is not as strong, or there are not a lot of assisting professions.
Right.
They are there, they are in the infantile form. So the help that you are talking about, that any resident from a high income country would have, it is still a far-reaching prospect for a lot of juniors that I know, or for the kind of residency I went through. So I get it. I think it would be a privilege, but then again, it wires us slightly differently, as we are tougher. I would like to
Yeah.
believe that we are tougher.
I
And
think so. I think you are.
yes, we are tougher, we are more mentally resilient at the end of it, because we have to, we don't have a choice with it. And we
Right.
also learn to not treat the walls, the concrete walls, especially, as barriers. So this is just a blessing in disguise. At least that is how I would like to frame it. So I have my last and concluding question. If you look back and you see whatever you have done. I am aware of BTRC. I'm aware that you were the editor-in-chief of a Journal of Neurosurgery. There are a lot of accolades that you hold. But if you look back 30 years from now, did you imagine that this would turn out like this? And are you happy that the 1,000 kilometers that you traveled, they were worth it? And yeah, or probably they were better than what you were originally assuming or imagining?
Yeah, thank you. That's a great question. And you know what? As I look back on my career, and I hope I can leave this conversation today on an optimistic note for everybody who's on the line, that as I look back and reflect on my 36 years now as a neurosurgeon, and I'm not at the beginning of my career, I'm towards the end, and very soon I'll be able to reflect in more formality and in detail on my accomplishments, what I've done throughout my career, what my contributions have been as a neurosurgeon, how I've cared for my patients and looked after all these things. It was dizzying at times, I can tell you, being in these roles, and time management principles were key to keep everything going on target and as planned. But as I reflect on it and I look back, I didn't set out to do any of the things that I accomplished. They just happened by virtue of my commitment to my patients, my interests in academics, research, the clinical work. But if I had to do it all over again, I would do it in a heartbeat, just the way it played out. Minor modifications, perhaps along the way, definitely had lots of time away from family, which we talked about at the beginning. Would there have been a chance to balance, the family commitments or time better? It was better in my generation than the generation before me in terms of how neurosurgeons related to their families, and I think it's better today with your generation and how your commitment will be with and relationships to family. But there's still a tremendous amount of a balance that's required, and I hope the principles that we talked about today will help those on the line who are looking for successful careers, just as I have been so fortunate to have had one here at the University of Toronto.
Thank you, Professor. That was beautiful. So to the residents and early career surgeons watching this, the 1,000 kilometers is not behind you yet. Some of it, in fact, a lot of it is still ahead. And what Professor Rutka has offered today is not a map. It is something profoundly more useful than a map. It is the honest account of someone who made the crossing successfully. And this is what this series exists for. The general sessions we have are academic sessions oriented towards the residents and their teaching sessions. But I guess these are where the passion still lives. So thank you so much, sir, for joining us today. This is a wrap.
Thank you very much, Dr. Ali. All the best to
Thank you.
everybody.
Thank you.
Yeah, see
Thank
you.
you so much.
Bye-bye.
Bye-bye.